Welcome to the Q's and R's, questions and responses for knee regeneration. Question 1 by Moni. This helps bone on bone? Question. I'm telling you, in so many years of practice, uh, I've had hundreds of people come in and say it's bone on bone. But if that knee bends, there may be destruction of the cartilage, there may be damage to the meniscus, there may be damage to all the supporting structures, but the knee joint is hydraulic. If that knee is fused, if the leg does not bend, then more than likely it could be bone on bone. I rarely, if ever, see that. But knowing that these structures are alive, the cartilage is alive, the meniscus is alive, the capsular ligament are alive, the anterior, posterior, cruciate, all the ligaments in there, they're all living tissue. And the way living tissue, it responds to different force loading and nutrients. So if you have bone on bone, then that joint won't move. Then there's not much alternative because you need movement to stimulate that regeneration of the tissue. But if that knee does move, just distracting it, and that's why we have that leg swinging exercise where you're putting, between 10 and 20 pounds on the leg and just dangling it, not lifting it up, because when you extend it, that kneecap, the patella is going to be driven into that. So this is a ligamentous-based exercise where it's a passive dangling of that joint. So that creates a negative pressure, allowing synovial fluid going in there. But remember, if you have had long-term knee problems, it's a knee alarm, not just a knee problem. So if it's degenerated to the point where a doctor is saying that it's bone on bone, you're also going to have altered biomechanics of the foot. You're going to have an unstable pelvis because your gait has been off. You've got to look at the lumbar spine because the nerves that come out that supply that knee, and I'm talking quadriceps, hamstrings, foot, everything has to be corrected. So if you're correcting the biomechanics of the calf, because in the calf muscle, there's the pump called the soleus. If you're correcting the biomechanics of the foot, the arch of the foot, if you're able to distract that knee because that knee bends, you're stabilizing the pelvis, you're restoring the nerves that supply that, so you got good quadriceps balance or good patellar tracking, and then the body can regenerate as long as you're dealing with the others. That's dealing with the physical stress, chemical stress, and emotional stress. So good nutrients. Look at what you're putting in your system, and certain medications, such as nonsteroidal anti-inflammatories, will make you comfortable, but they decrease your body's ability to regenerate because they decrease the building product of cartilage called proteoglycan production. So when you're fixing all of that, then you have the best chance of regenerating. If it truly is bone on bone and that knee doesn't bend, then surgery is going to be the option. But I'd really assess everything first. Question 2. Had a double meniscus tear with fold back. First surgeon said to do physio and would not operate. 6 months later, and lots of money for the physio, was worse. Second surgeon looked at the MRI and said it needs to be operated on immediately. Now almost 8 weeks later and still in pain. Maybe I'm a slow healer, or maybe physio was too early in 2 weeks. Seems like no one really knows. Absolutely. Oh, and this from Ted E. Butio 9511. Ted, let's get you healthy. Okay, so when you're looking at this, a lot of doctors, and this is where a lot of the medical world, and I'm talking holistic, natural, homeopaths, chiropractors, medical doctors, when presented with knee pain, they're going to look at the knee and look at the structures in the knee, and they're going to see, oh yeah, this was torn, this was strained, this is inflamed or something, but they're not going to look at other supporting structures like the foot, the calf, the quadriceps balance, and since your knee has been an issue for a while, your gait is going to be off, and if that pelvis is unstable, that's going to negatively affect the lumbar. And if you got compromised nerve supply to that knee, that means the quadricep won't be firing correctly, the hamstrings won't be firing correctly, and the foot for sure isn't going to have dorsiflexion. So the muscles on the back of the calf, called the soleus, which is the pump, isn't going to be functioning correctly. So look at all knee problems, even if you've had a a clipping injury and you've had, the terrible triad of Donahue, medial collateral ligament, medial meniscus, and anterior cruciate, if you significant trauma, you got to look at everything. Because if that trauma's been there, that gait is off, and you've got to look at all the supporting structures. So this is why the physical therapy generally is not effective unless they're addressing the lumbar biomechanics, the pelvic biomechanics, the calf biomechanics, and the foot biomechanics. Then you got to look at the other things. How are you sleeping? How are you pooping? Okay, if you're getting 2 to 3 healthy bowel movements a day, beautiful. If not, if you're lucky, that means you're in a sympathetic dominant state, so your tissue regeneration will be decreased. This is why bone broth, juicing and blending, appropriate nutrients, getting your body the raw materials is going to be hugely important. But you've got to look at the surrounding structures. And you are not a slow healer. You are designed to live in here. Slow healing just means that either you're not fixing the actual problem. Again, knee pain, even if you've had a trauma to the knee and you've been walking on it for a few weeks or months, okay, you've got to look at the other structures. It's not going to heal unless you correct lumbar, pelvis, calf, and foot biomechanics, nutrition, change the sleep patterns, look at everything. And that is called holistic, but it's just flat out common sense. And then your body can regenerate. But typical medical doctors, and the medical doctors are the ones that are directing the physiotherapist, and they're not going to be addressing the secondary and tertiary adaptive responses that you're going to have if you've had a knee trauma. You got to look at everything, and then your body can regenerate. Question 3 from Nelaco Constibianco. I'm presently getting cold laser therapy on my left knee for an MCL sprain strain. Any other advice? Yes. Cold laser is excellent. It'll stimulate metabolic response. Also, look at the distractive force, but look at all the altered mechanics. Okay, since you have had an MCL, that medial collateral ligament is attached to the medial meniscus. So you have got to get a distractive force. And I demonstrate how you can distract that, but typically your foot's in between the chiropractor's legs, and when he leans back, that joint opens up. And then to do a slight bend of that knee with very, very minimal pressure on the medial aspect where that medial meniscus and medial collateral ligament are. And I'm talking you push with no more than a pound and a half of pressure, because this could be exquisitely tender. That's going to help to replace that and reposition it. Plus, with the distractive force, you're going to increase synovial fluid production. But look at also the biomechanics of the foot, calf, pelvic instability, lumbar associated issues as well. Then, when you're distracting the knee, okay, have the chiropractor look for bursa sacs or swelling of that capsular ligament. Typically, I'll see it on the back. I might even see it underneath the patella. And this is going to require a distractive force. So you're pulling that apart and you work that tissue to increase the pressure inside of the bursa sacs. Because remember, you've got tendons crossing the joint. Bursa sacs around that are filled with bursa fluid. In knee injuries, sometimes those bursa sacs can get injured and fluid will flow in and not flow out. So there can be a pressure building up in there. And the way you correct this is to increase the pressure of that bursa sac on the tendon, and that can de-stress out that joint. And by de-stressing out the pressure on that tendon that shouldn't be there, have your chiropractor contact me, give me a call, and I'll walk them through how to do that correction. But as long as you're addressing everything, fantastic. There is one more thing that I like too. Anytime you put heat on a knee, just think of this. If you put heat on my arm and take it away, the arm's going to be red. That's because the brain senses that difference in temperature and increases the blood flow to equalize the temperature. So if you put just a neoprene support on it, now you don't want to support with anything on the side, and I'm talking just neoprene, and you could Velcro it over your pants, and this will generate a little bit of heat and help increase the metabolic response of that. So any distractive force you do, like just leg dangling, then it's going to heal faster. Question 5 from Rome Waltz 3216. Back in 2021, I went to a chiropractor, did some tests, found out I had a bulging disc in my lumbar spine. I've been having pains for about 5 years before that. I used to play basketball when I was younger. Last time I played was about 10 years ago before the back pains. I had a lot of knee pain during basketball days, and even now, when I step on a staircase, I feel the pain and discomfort. If I stoop, it's tremendous work to stand up straight. Doctor told me I have osteoarthritis. How do I fix the bulging disc and the knees? Fantastic. Okay. Make sure that your chiropractor is distracting, and it's called a lumbar flexion distraction, where he's opening up that lumbar spine. But ideally, you're going to be taking bending films of the lumbar to identify disc dysfunction. And that's a weight-bearing film, because MRIs, typically you're laying flat, and that's tough because the gravity is pushing down and the table's pushing up. So the MRI might not be as accurate. And then you're only looking at the lumbar. I know you have a lumbar disc, but imagine if you have a lateral translation of the thoracic area. So playing basketball is really, really tough. That's extremely physical. I've got a couple of pro basketball players as patients, and I'm telling you, it is really physical. But if you have a lateral thoracic deviation or forward head carriage because of loss of curve in the neck, that can change the force loading on the lumbar, and that can have a consistent irritant. So look at the entire structure for sure. Knowing that this has been going on for years, the lumbar isn't the only thing. You're going to have an unstable pelvis. You're also going to have a flattening of the foot. Like when you look at your toe, your big toe will be leaning towards the other ones. That means that the nerves to the foot are compromised, and that foot is supposed to have arches to cushion your gait. So we got to restore the biomechanics of the foot. The knee joint is hydraulic, and that calf muscle is going to be hugely important. So look at our pelvic health video that will help change sitting into therapy. It will also help to where you can distract that joint, create a negative pressure, and these are all ligamentous-based exercises, but have your chiropractor walk you through it. If he's not familiar with it, have him contact me, and I'll walk him through it. And, osteoarthritis. Remember, osteoarthritis, arth means joint, itis means inflammation. Osteoarthritis is a non-inflammatory joint condition. It's only from trauma. And there's laws. It's called Wolff's Law. Bones lay down where it's needed, resorb where it's not. So any bony deterioration or bony adaptation to the altered biomechanics, because that's what it really is. When you're looking at osteoarthritis, you can actually see the joints get compressed and the bone changes its shape. And that's an adaptation to altered force loading and altered biomechanics. And so if you can change that force loading and biomechanics through Wolff's Law, even the bone can remodel. So yeah, just giving you a label of osteoarthritis doesn't tell you that that is reversible. It's from a trauma. Question 6 from Wendy Perry, 8913. Thank you for your brilliant information. God bless you, dear. Can you please demonstrate with a video how to do the kettlebell exercise? Are you static, doing one leg at a time, walking with them, or what? It's not clear how to do it. Okay, yeah. So the distraction, you don't want to just do one leg at a time unless you've had a knee replacement. Then you can't do that on a knee replacement. Okay, what we want to do is do both legs, because you can have a one knee symptom, never a one knee problem. And just think of it, bam, you hurt this side, your body's going to shift off to the other side. So if this is the hurt knee, this one's going to be moving twice as much. So you got to rehab both. Okay, and what is that called? Common sense. And I know. I've got to explain this to doctors. Okay, so the only difference between the kettlebell and the ankle weights. Ankle weights are great, okay? You put it on, it's fantastic. You get the distractive force. Don't extend your knee all the way. You just want to dangle it. One of the reasons I like the kettlebells is it's faster because you just slide your foot underneath. But then what the kettlebell does in addition, or a little added benefit as opposed to the ankle weight, is you're strengthening the muscles on the anterior portion of the calf. Now, normal strength ratio, the muscles on the back half of the calf versus the muscles on the front part of the calf, or the posterior versus anterior, Normal strength ratio of a calf is 10-to-1 ratio. That means the muscles on the back are 10 times stronger than the muscles on the front. If there is a muscle imbalance, such as with jumping sports, high heels, poor flexibility, that you could get a 10 or 15 or 20-to-1 ratio where that can cause the muscle in the front, the body's going to protect it by cross-fiber adhesions. And this is literally where shin splints come from, or one of the sources of it. It comes from a muscle imbalance of that posterior musculature versus the anterior musculature. So using that kettlebell, and unless you're used to it, it can be uncomfortable. So put like a towel around the handle. But it's really easy for me because I just slide my feet in there and then you could dangle it. So then you're working the anterior muscular, or the muscles on the front, and you're distracting the knees. You're getting a 2-for-1. And, I like anytime you can get 2 exercises in one effort, beautiful. However, it might take a while to build up to that. And hopefully that cleared it up. Now, if your question wasn't answered here, please go to the drbvip.com site.